Hi guys, this is Dr. Gilead Show. Welcome back to today's episode. Today is May 4th, 2017. We're back on Dr. Gilead Show. We are on WBGI Radio and Facebook Live. You can call on 301-429-9247, 301-429-9247. I am your host, Dr. Theo Oswala, and you can reach us on Facebook on Dr. Theo, one word, Oswala MD, one word, Dr. Theo Oswala MD at Facebook. I want to welcome you back to Dr. Gilead Show. Today is May 4th, 2017, and today we're going to be talking about PCP Use Disorder, PCP, phencyclidine. This is a very big one these days, but before we go ahead on the show, it's always good to let you know, please do not use what you hear on this platform to make a diagnosis of yourself or someone else. Do not treat yourself based on what you hear. It is always good to get the appropriate treatment from a trained provider. And please, Dr. Gilead Show, the producer and the host, are not responsible for what anybody does based on what they hear on this platform. All right, PCP Use Disorder. This is a phencyclidine, and it was originally developed as an anesthetic agent. PCP was marketed as Ceniline, but because it caused a lot of side effects, caused agitation in the patients, it was used to anesthetize, so it was stopped, and it was abandoned. But then some young people started using it as a substance. Now the other names are phenylcyclohexylpiperidine, phenylcyclohexylpiperidine, and I guess that's where I got the name PCP from. Other street names of this very powerful drug is angel dust. Some call it crystal hug, embalming fluid, ozone. There are other things they call it like wet, rocket fuel, and sometimes because it's mixed with marijuana, they call it crystal joint. Also, some call it mint weed or supergrass when it's mixed with marijuana. Also, it's been known that some young people have mixed it up with cocaine, and when it's mixed with cocaine, they call it space base or tragic magic. So it has all kinds of street names, but it is good to know some of these street names, so that when people are talking about it, you know exactly what they're talking about. All right. Now, a PCP or phencyclidine is a hallucinogen. That means it alters your state of mind, and it makes people hallucinate a lot of the times. People who use PCP say they feel like they are in a trance. They are like in a trance-like state. Sometimes they feel detached from their bodies and the environment. So they are in a place, but they feel like they are out of that place. Some say they feel like they are observing their bodies from above. So it completely detaches the individual from his body and from his environment. Now, we know that PCP can be smoked. It could be ingested orally, sometimes snorted nasally, or it could be also injected intravenously, IV. Today, most people who use PCP use it by smoking, and sometimes, or most times, they add it to cigarette or to plain marijuana. And this is one reason why I advise a lot of people who come to my office who smoke cigarette or even plain marijuana, do not. And I say do not take cigarette, marijuana from somebody you do not know. The cigarette or marijuana they're giving to you might be laced with phencyclidine, and I had a patient who remembers specifically at the bus stop, he took a cigarette from somebody, a stranger. He said, "Hey man, can I get a smoke?" And the guy gave him a smoke. He remembers the time, and as soon as he did it, he felt a click in his brain, and he's never been the same till today. This was about 7, 8 years ago. So that would tell you how dangerous this drug could be. Now, how common, how prevalent is PCP use? The real prevalence of PCP use is unknown, because I mean, a lot of people who smoke PCP will not indulge in the research or in the clinical information provision. But it is known that approximately 2.5% of the average U.S. population have used PCP at one point in their lifetime. So on the average, about 2.5% of everyone who live in the United States at one point had used PCP. It is also known that the prevalence of use of PCP increases with age. Ages 12 to 17, about 3% may have used PCP at one point in their or the other in their lifetime. And when you hit age 18 to 25, it increases to 1.3%. So a 1% jump once they attain teenage when adulthood. But it's also known that above 26 years, about 2.9 people have used PCP. Now, if we look at the cultural racial divide in the use of PCP, among those that use substance abuse who are presented in the emergency room for treatment, 49 those who use PCP, 49% were blacks and 29% Hispanics. So it is known that more African Americans use more PCP, especially with those who present for treatment, and followed by Hispanics. When you look at male-female ratio, it is known that more than 3/4 of those who have used PCP are males. And this is not uncommon with most substances. So we have, statistically, we have more black people and Hispanics, and also more males using it. And the older the age group, the more chances that they may have used PCP at one point or the other in their lifetime. So what are the symptoms you could observe when people use PCP? What are the things we look out for as physicians, healthcare providers, or even family members? What is it you will see and you say, whoa, something is going on here with my family member? Now, you will notice that a person who probably has smoked PCP one time will begin to use it in large amounts and over a longer period of times than was intended for. So he may have said, okay, I'm going to use just a little bit, and from then he begins to use it in large quantities and use it for an extended period of time. And they have strong craving or desire or urge, a very big urge to use PCP. And many times they try unsuccessfully to cut down how much they use. They will try several times because it's a torture, it's a pain. You're hallucinating, you're completely out of your mind. But still, they want to stop, they cannot. So they make several attempts to stop using PCP, but they cannot help themselves. Other symptoms or other things we look out for is history of spending a lot of time in activities to get the drug. Of course, it's not sold in drug stores or in liquor stores or in gas stations. No, you have to know someone who sells PCP, and a lot of these people spend a lot of time running from one place to another to buy it. And they also use a lot of time to recover from PCP use, because when you use PCP, people are disoriented, disorganized, and after that they go through periods when they have to recover from the use. So someone is spending a lot of time looking for it, spending a lot of time using it, and has to spend more time to recover from the use. That is classical of PCP use disorder. Now, when this happens, they are unable to fulfill major obligations at work, at school, or even at home due to the use. You see someone who usually goes to work, they begin to call out more, and they miss out from work. Or when they get paid, after payday, they don't come to work Monday, Tuesday, Wednesday, until they finish the money they got. This is classical. And at home, they are almost useless. They have nobody. They're stealing. They're trying to get their high. That is PCP. The people want to use and use and use. Another symptom is they continue to use even though it causes them physical problems, even social problems, and also interpersonal problems. They continue to use even though they have severe headaches, chest pain, even some people may have seizures. We're going to look into the symptoms or the after effect of use of PCP. So they have all that problem, still they continue to use. Sometimes they have very important social, occupational, or hobbies that they give up. So someone who used to play basketball, good hobbies that they enjoy doing, going fishing with family, they cut out all the time they have. They want to use to chase PCP, use it, and recover from it. Even though they have gotten into problems, they still use PCP in very hazardous situations like driving or even operating machines at work. And I had a patient who recently was at work, and because he was high, he was operating the machine. Because of his disorganization, he cut his finger. The machine chopped off his finger because he was high. So even though they know that they could get in trouble, they could hurt themselves, they still continue to use. Sometimes they develop tolerance. They need to use more to get the desired effect, the desired high that they love to have. These are all pointers that this person is addicted to phencyclidine or PCP. Now let's look at some of the symptoms when people are under the influence or they are intoxicated with PCP. Now, number one among those is euphoria, a sense of feeling of happiness, too happy, and for no clear reason. Someone who generally is a mild person, mild personality, calm, collected, and for no reason they are talking loud, laughing, and you say, hey man, what's going on? Why are you laughing? And of course they're not going to tell you they're high. They'll tell you, oh yeah, I was just thinking about something, or I remembered something. So they have euphoria and an excessive feeling of happiness. They also have mood swings. From the euphoria, they're feeling so happy, they swing to intense irritability and anger and outbursts. So they swing from very high mood to low moods. From feeling very happy to anger, and for no clear reason. You imagine, whoa, what's going on with this person? He was just talking nice, he was just laughing, playing, and now he's into a big fight. And he doesn't seem to understand why he is going through all that. So this is very, very common with PCP intoxication. And it causes so much problem. Now, people, when they are high on PCP, they have intense anger, very severe anger, which even they themselves, after they get better, they have no memory of what just happened. They can't remember. And people say, hey man, you were so angry. You did. They have no idea. They can't remember. I had a patient who, he was high on PCP, and the way he was behaving, someone called the police. And when the police came, He ran to the police. He was banging on the top of the police car. The policeman was so afraid he didn't come out. He called for backup, and of course he was still jumping all over the place with 6, 7 cops all around him, so they had to tase him. When they tased him, he calmed down and he was taken to the hospital. So there is this intense anger, disconnection, mood swings that is classical of PCP intoxication. Sometimes they could be overtly calm for no reason. You're wondering what is going on. They are too calm for themselves. The other things, if you look at their eyes, they have what is called nystagmus. The eyes are going that way, the eyeballs are going, sometimes left to right or up and down, which is what we call vertical nystagmus, vertical or horizontal nystagmus, and they can't control it. It's an involuntary movement from the effect of PCP on the muscles that control the eyeballs. The other things they have severe high blood pressure, and they have tachycardia. Their heart rate can hit up to 160. Their blood pressure can hit up to 200 over 150, 140. It is dangerous, and that is why sometimes they could have a heart attack or they could have a stroke. So they have high blood pressure, increased heart rate, they're disorganized. Now also they feel this numbness and poor response to pain, so they don't feel anything. And that's why they can jump from a 2-story building and even fracture their leg or their ankle or their foot, and they still don't feel anything. They keep jumping because they feel numb. They have this poor response to pain. Remember, PCP originally was manufactured as an anesthetic, but because of the agitation and the problems it caused in people, it was discontinued and no longer being used. Now also they have dysarthria. The speech is messed up. They don't talk well anymore. Sometimes their speech is slurred, all because of use of PCP. Other things they have are things like muscle tightness or muscle rigidity. The muscles become rigid and tight and they feel stiff. They also have stuttering. Someone that normally talks well, he begins to stutter. These are all the effect of PCP on the muscles. Sometimes they have this blank wall-eye stare. They're just looking, they're staring into space. And you say, hey man, what's going on? They're just staring into the wall. They're blank. They're lost. They are out of their bodies. And the other symptoms are that they are hypersensitive to sound. Even when people are high on PCP, even regular speech or regular volume of talking by friends will irritate them so bad. Low music will make them angry. So you have to be very careful when people are going through this intoxication. So they are hypersensitive to noise, little things, they get into fights, and they are very irritable with a lot of mood swings. Now let's look at other things. What are the psychological factors? They have loss of memory, amnesia. They have no knowledge or no recollection of what is happening to them. They could hit people, attack people, even sometimes could kill. And after the drugs have gone out of their system, they have no recollection of what they've done. And we've seen in the news where people attacked people. There was a guy in Florida that ate up somebody's face. I'm not saying it's PCP, but these are all hallucinogens that affect people, that disorient people, and they do strange things without remembering. The other symptoms are they have lack of motivation. They have no drive to do anything anymore. So a person who had a good job, had a good car, had a house, family, once they start using PCP, they're completely gone. They don't even remember anything. They have no interest anymore, no motivation to do anything. And of course, what happens They lose their car, the car is repossessed, they lose their housing. What else? They become homeless. So it's a spiral downward activity. So these we must watch out for in family members. Other things, other psychological effects are they have delusions. Delusions are beliefs that are not real. But to them, under that influence, it is real. So they could become paranoid. They think someone is doing something to them, and they can attack people. They have. They're passing by, and someone is looking at them, and they say, well, why are you looking? What's wrong with you? You got a problem? And before you know it, they're fighting because they think the person is saying something about them or is planning against them. So they become delusional and they become paranoid. They have hallucinations. This could be visual or auditory, and that means they see things that are not there. Their mind is playing trick on them. They begin to hear voices, people saying things, or they hear things, and really there's nobody there. So they have altered sensation. They hear voices that are of people that are not there. They see things that are not there. Sometimes they feel things on their skin, crawling sensation. Sometimes that is more common with cocaine use, which we're going to talk about sometime in the future. So but they have another thing. They have is severe attention problem. They get highly distractible. They cannot focus. They are all over the place. They start something, they don't finish. They're so disorganized, and people say, man, what you smoking? What's wrong with you? They're jumping all over the place. And sometimes they come to me, they say, oh, I have ADHD, I need medication. But in course of talking to them, you find out this dude has been smoking PCP. And when I work with them, help them out, gradually they withdraw from PCP, they stop doing it, and their attention and concentration will return back. But sometimes, because of severe increase in blood pressure, they have rupture of tiny blood vessels in the brain. When that happens, they have a permanent damage to the brain, and their behavior, it will be difficult to return to normal. Then they begin to present like people that have classical bipolar disorder with mood swings. So these are some of the effects of PCP use. Now, what are the long-term effects? Is someone who does PCP over a long period of time, the question is, what else? What are the symptoms that they have? What are the side effects that they have? What are the problems that that they have? They have lack of coordination. They cannot coordinate. They cannot take care of things they used to do before. They can't even put their mind together to do a thing. Other things long term is feeling of no pain and numbness. So that's why you can get into a fight. They tear up their head, rupture spleen, hurt them, break bones, but yet they are fighting. So they have this long-term feeling of numbness and lack of pain. Sometimes they become suicidal. And we have seen people who are high on PCP, and probably they've been thinking about how to kill themselves, but once they are high on PCP, they don't think about anything. They are disoriented, disorganized, detached, and they kill themselves. They could also be homicidal. They kill people because they are detached. Things they probably could not do when they are thinking straight. They go ahead and do it because they are delusional, paranoid, and disorganized at that point. So on the long term, they could become suicidal or homicidal. Sometimes they feel invincible, they feel unstoppable. They think they can conquer the world. And when they are high on PCP, they think everyone else is little. They can do anything that initially they will not attempt. And that's why they get in trouble, they get into accidents, they hurt people, and without real recollection. So sometimes because of that feeling of invisibility, they do things that they really should not do. The other things is they have poor judgment. Their judgment is zero. They dive into swimming pools, or they jump from heights, or they drive so fast. Poor judgment because of the disorganization. Now they have memory loss, sometimes permanent memory loss, brain damage because of the it could be from increase in blood pressure, minor strokes, rupture of blood vessels, damage to the brain, so they have memory loss. Other things they may have severe anxiety disorder. Because of the long-term effect of PCP in the brain, they have this feeling of agitation, feeling of nervousness. They can't sit still. They just want to go disorganized, afraid something bad is about to happen. They have this sense of impending doom, this sense that something bad is about to happen. Because they're paranoid, they can't think straight, they're worried, they worry over nothing. They also indulge in extreme violence, and they get into street fights, shooting people, bar fights, and they may get hurt or hurt somebody. They also have intense aggression for no clear reason, just because they are high, and because I believe because they're paranoid and suspicious, they become very, very aggressive. And the other symptoms are brain damage. So these are all classical of PCP intoxication and long-term use of PCP. We shall look at other aspects of PCP, both the detection and the treatment and the support that is out there. But don't go away. We'll take a short break. You're still on Dr. Gilead Show. Don't go away. We'll be back in a minute.
Sounds good. But you need to, the sound comes from front of the mic. Fine. Other way. Other way. Other way.
And so much more.
Yeah.
But
Right
guess
there.
what? You do need a representative
But it sounds good
to
though.
order a file, so you can order online and have the product shipped
How you doing?
directly to you.
Thanks for coming out,
You
man.
have to
How you been?
log on to
He wants to do it every week now.
www.yourafine.com.
Yeah, I can't hang out like that. You know that comes through there now too, so I hear the commercial, which is good.
Happy shopping and enjoy your product.
Don't worry, sir. Help is on the way.
Evangel Cathedral invites you to travel back in time to witness the first reported case of identity theft as we present Stolen Identity, the story of Esau and Jacob, this Saturday, July 25th at noon and 4 p.m. Admission is free, but you must have a ticket to get in, so call 301-249-9400. That's 301-249-9400. Stolen Identity.
No.
Yeah?
Are you ready? Okay, you can press. And press lock on.
All right, guys, welcome back to Dr. Gilead Show. Thank you for being with us during this short break. We are talking about PCP use, phencyclidine, which was originally manufactured as an anesthetic agent, but because of the agitation and problem it caused people, it was never used And since then, people have been getting high on it since the 60s. All right, we've talked about the symptoms, the use, the problems. Let's take a look at how long can PCP be detected in your body. A lot of people come to me and they've been using PCP, they want to go, they get a job, and they're about to pee them, they're about to test them to see what drugs they're using. They ask, hey doc, how long would it take for the PCP to get out of my system? Now, the half-life of PCP is 3 days. Now, but the effects can last up to 7 days. So if you smoke PCP, it could still be in your body for 3 days. But now, PCP can be found in the urine 4 to 6 hours after it's been used. But sometimes, if you've been using it for a long time, it could still be picked up in the urine 7 to 14 days, average of 8 to 10 days. So even though you've been on PCP, even though you haven't used PCP in about 1 week, it could still be found in your urine. When your blood is drawn, PCP can be found in your blood within 1 to 4 hours after use. But it's not normally, blood is not normally drawn unless in the emergency room when somebody comes in a very agitated state. They may look for it in the blood, but normally that's not the major place that is looked for. The other place that it could be found is in your saliva. And after use of PCP, in 5 to 10 minutes, it could be detected in your saliva. And it could also still be there 3 days after you stop doing it. So quickly, 5 to 10 minutes, the PCP could be found in your saliva, and it could stay there for up to 3 days or even a little more. Now, this is very important. In the hair, PCP can be found in a strand of the hair 5 to 10 days after use, but it could still be on the hair for 90 days, for 3 months. So, and that is where employers check for drug use these days. So you cannot do PCP and say after 1 month you want to go for a job interview, they're going to take your hair and it will still be there for up to 3 months. So these days, most employers don't even do urine or saliva anymore. They take a strand of your hair. So if you used PCP 3 months ago, it will still be found in your hair. So we must be very careful. I don't think it's really what doing the PCP, but people, when they are addicted to it, they're hooked onto it, it's hard to quit. Now, so let's look at what are the morbidity and mortality from PCP. People have died from use of PCP, and it's usually from overdose. When you take so much PCP, what happens? The blood pressure goes on too high, and the heart can no longer take it. The heart will stop, so the person will have a heart attack, or they can rupture a major vessel in the brain. That will cause severe bleeding, stroke, and depending on what part of the brain the blood vessel is ruptured, they may not make it. So death is either from severe overdose. Now also, it could also be from suicide, because they are disorganized, disoriented, wanting to kill themselves, but had no courage to do it. When they are using PCP, they're feeling invincible, then they are able to carry it out. That is suicide. Because they also have bizarre behavior, disorganization, racing thoughts, high energy, feeling invincible, they get into accidents, motor vehicle accident, jump in front of the train, and all that. So that death could come from any of those. Now, what are the risk factors? The risk factors for PCP use, number one risk factor is male sex. That is, males. 72% among those that use PCP are males. Now, also, African American race is also considered a high risk because in the emergency room, those who presented for treatment, most of them were blacks. Also, young adult age is considered a risk factor for PCP use. Let's look at what are the complications. When someone uses PCP continuously, what are the complications that may arise from it? Now, poor safety is number one. Because they have poor judgment, they take more risky behavior. So, they have poor safety standards at that time. Because of their impaired judgment, poor judgment, they get into severe motor vehicle accidents and they die or kill people. Other complications are relationship problems. So they lose their family members. They had a boyfriend or a girlfriend, a wife or husband, as the case may be, or a partner. No partner will be able to tolerate continuous use of PCP, along with the aggression that goes with it, or even the fights, getting in trouble, getting locked up, police involvement, police raids. No partner, no husband, no wife can take that for so long. So they lose relationships. They have problems with their immediate family and other relatives. The other complications are poor work performance. If you're high on PCP, you can't really do much. You can't do much. You're always out of work, and performance will be poor. So most of them lose their jobs. The other things are violent crimes. Because they are disoriented, disorganized, they indulge in violent crimes. They rob people, stick people up and take their possessions, snatch cars, and all manner of crimes, rapes, and because also they are disorganized and they could also be victims of violent crimes. So they could get killed or they could kill people. They also have a lot of legal problems. They are arrested for either trespassing, fighting people, hurting people, being at the wrong place, or disruption of peace, and they get in trouble. They have a lot of legal issues. These are some of the things that could cause problem to them. Now, there are other things that have financial problems. Financial problems, of course, we know it costs money to do PCP. So they're spending money and they run into financial problems. They pawn their belongings, everything they have. They lose their car, they sell their cars, and all manner of things. They lose major things that they have, and they end up homeless, and they're not able to achieve anything. So they lose all their belongings. This will generally affect them, affect their family, and it's a lot of problem for them. Because they are disorganized, they indulge in risky sexual behavior. When someone is thinking properly, they choose their sex partners. But when someone is high, disorganized, out of his mind, he doesn't care who he has sex with. And of course, they don't use protection. So they get all forms of sexually transmitted disease. So they could get it, or they could also be victims of rape. You see, there are people who normally would not indulge in such behaviors. They jump out there, whoever says hello, they go, whether male or female. So they could be, they indulge in risky behaviors. They could also be victims. They could be raped or they could be hurt. Suicide attempts and completed suicide is a major complication of PCP use. And this is not uncommon. because of the disorientation and disorganization when people are high on PCP. What are the effects of PCP use on our health? A common medical problem is seizure. People have seizures, epileptic seizures, and if they are driving, they could get into accidents, they could hurt themselves, they could seize so much that they have a brain damage, because when people are going through seizures, oxygen supply to the brain is reduced, and so they can have a permanent brain damage. Other effect on our health is stroke. They could get a stroke all from severe increase in blood pressure, severe hypertension. They could also have a heart disease because of severe hypertension. The heart cannot cope anymore. They have a heart attack. The blood supply to the part of the heart that is diseased will also have a problem, and they could have congestive heart failure and all manner of cardiac problems. Now, because they have sustained high blood pressure during the time of intoxication, tiny blood vessels in the brain will rupture, and this could, at the long run, present with memory problems, dementias, and they end up having so much problem with recalling things, and their future life will be a total mess. Having said all that, how do you treat a patient who has PCP use disorder? How do you treat the person? The first thing, if a family member or even a provider sees somebody they think has PCP intoxication, because they are violent, because they are dangerous to themselves and other people, the first primary thing to do is to call for help. You can call the sheriffs or call the police, and they will come. If he is controllable, he'll be taken to the hospital. When they are in the hospital, one, they are protected from themselves, and also people are protected from them. That way, they don't kill themselves or they don't kill other people. That is one. Because it is a very severe disorienting addiction. You must protect them from, must protect people from them. So when they're in hospital, you put them in restraints. This could be physical restraints. You can tie them down to the bed or put them in leather jackets, as the case may be. So, and they put in a quiet room, because noise, people talking, will aggravate them. And because they are dangerous, they need to be put in seclusion. So once they are in a safe place, the next thing to do is to give them benzodiazepine. This is a tranquilizer that is used, one, to calm them down, two, that will reduce the blood pressure and prevent cardiac problems, strokes, and it will also calm them down, so they will not be, the agitation that normally happens will be taken off. So it takes the edge off, they calm down, they are able to sleep. The muscle tightness they have, and all the tension, the feeling of anxiety and impending doom, the benzodiazepine will calm all that down. And normally we use diazepam, which is Valium, but if they have a liver disease, because it takes, if they have liver disease, they may have problem metabolizing diazepam. You use a shorter acting one like lorazepam, which is Ativan, and it's given quietly, intramuscular or intravenous, and they will calm down within a very short time. Now, because they have psychosis, which includes hallucinations, seeing and hearing things that are not there, because they also have delusions, believing that people are against them or out to kill them, they are given antipsychotics. This is done if after the benzodiazepines calm them down and they are still delusional and paranoid. I have seen people under the influence of PCP, they're looking all over the place, looking all over the place, like someone is watching them or out to get them. Under that condition, you give antipsychotics, and we normally will give things like olanzapine, risperidone injections. And if you are in a place, whatever is available, if you have haloperidol, you can give it, and it will calm them down. It is important that when they are in hospital to watch out for seizures, because that is very common. Depending on how much PCP they have used, they could also go into coma. And if nothing is done, they can die. So once they are in hospital, it's always good to prepare for respiratory support, because they could go into respiratory failure. They can't breathe anymore. The doctors will have to take over their breathing. And people have been under this condition for days before they recover. Once they've been stabilized in the hospital, they must see a psychiatrist who will give them substance abuse treatment. This is very important, and once they get to a psychiatrist, he will evaluate them. One of the psychiatrists will treat other psychiatric problems that may be co-occurring, because what happens is people do drugs sometimes to self-medicate. So for someone who is always depressed, feeling down, feeling down, no drive, no energy, and someone says, man, smoke this little PCP, it's going to give you energy. Or some who have low self-esteem, they take a little hit of PCP and they feel invincible. They feel they can talk to anybody. They can do what they never thought they could do in the past. So the primary cause of using PCP may be because of some underlying mental health problem. So once you send them to a psychiatrist who will do an evaluation and examine them properly and determine what their primary illness is, and they can be treated. Once they are treated, they may not go back to using PCP. So it is always important to do the appropriate referral and discharge to a trained personnel, a psychiatrist, and they will give that person the appropriate treatment, and also do some treatment for the addiction. Because a lot of times they don't use only PCP, they also use other substances, marijuana and sometimes cocaine. So they need appropriate care to help them go through this very addictive substance. PCP is very addictive, and that is why when someone had used PCP, it is hard to quit. It's very, very hard to quit. So they need every support they can get. Now they also will need individual substance abuse therapy. So they have individual drug abuse therapy where they meet one-on-one with an addiction counselor, and also they will benefit from group therapy. In group therapy, they meet with other people who are doing the same substances, and they learn how this person or these other people have been able to manage their addiction. They share ideas, they help each other out, they learn how to stay clean, and sometimes they get a sponsor. And because they're in a group, they try not to use substances, because it will show that they let themselves down in the group. So both individual therapy and group therapy have been shown to be very helpful and successful in managing PCP use disorder. Now there are other co-occurring psychiatric illnesses. Commonest are things like bipolar disorder. When people have bipolar disorder, they make poor judgments, especially when they're in their manic phase. They do things that usually they will not do. They end up doing things that actually, under normal circumstances, they will not do. So that co-occurring psychiatric illness needs to be treated. If they have depression, it also needs to be treated. And people who have psychosis, whether schizophrenia or schizoaffective disorder or other psychotic illnesses, usually excuse me, may end up making poor decisions, and they use PCP, and that will make their illness worse. So they need to be appropriately treated. Now, if you are using PCP and you are listening to this podcast, I would advise you to please go get help. You can call any psychiatrist. You can call my office on 301-577-9111, 301-577-9111, and we'll bring you in and we'll help you. Family members, you can also get help. You can take the person to the emergency room. They need help, they want to stop, but they cannot help themselves. So you can always call for help, and that will support your family member, and they will do well. It is important that everyone recognizes the symptoms and presentation of PCP use disorder. That way, you can catch yourself early. Family members can find out, can notice what is going on, and help you so that you don't kill yourself or kill other people. So today we've talked about PCP use disorder. We've gone through the symptoms, the prevalence, and the presentations. And we've also talked about the treatment. It is very paramount that you go get help. There is help out there. You cannot continue to suffer in pain using PCP to self-medicate. There is help out there. Go get some help. You can call to my office, as I said, 301-577-9111, or you can Google and call any hospital. You can go to the hospital, go to the emergency room, and you'll get the help you need. I want to thank everyone for tuning in today on Dr. Gilead Show. We'll meet again next week, Thursday at 1 p.m. We're going to be talking on a lot of series on substance abuse, and we'll have some addiction therapists come in and discuss what they do. Thank you for tuning in. Have a wonderful day. Please tune in again next week, Thursday at 1 p.m. on Dr. Gilead Show. Have a nice day.